Well, let's begin this story the same way that we started some of our other ones, and that is to say, do not panic. Most kids who get RSV will do just fine at home. Now, it is nothing new. The virus has been around for a very long time, but there is no vaccine as of yet, and hospitals are definitely dealing with capacity problems.
It's very scary.
Catherine Morgan's son, Grant, is just 2 months old.
Respiratory distress is very concerning. He has such little lungs and can't really breathe, has a lot of mucus buildup.
A few days ago, Grant got a fever of 101 and had a small divot in his chest.
In 4 hours, he was using his whole body to breathe.
Rushed here to Connecticut Children's.
It makes me tear up thinking about it.
Describing the intense scene inside.
Once we got in, there's gurneys throughout the hallway with families just waiting for a room.
Confirmed by Dr. Ian Michaelo.
We have, every available bed being used.
In preliminary talks with the National Guard to set up a field hospital, Connecticut Children's has implemented a plan to make more beds available for kids who need the highest level of care.
We're asking for volunteers to help us. We are hiring additional people to work after hours.
First COVID, now RSV, stressing pediatrics to its limits at a time when many practitioners have already left.
This is an increased number of patients with a system that is really, was already having some cracks, and I think it's exposing some more of those cracks.
Dr. Mark Auerbach of Yale telling Fox 61 that nobody who needs critical care will be turned away.
We're really all hands on deck.
But a lack of pediatric ICU beds means patients are having to stay in the emergency room longer.
And the real concerning thing with this surge is the capacity in the intensive care unit and the emergency department, where the life-saving treatments are really time sensitive. And when we're beyond capacity, sometimes that could potentially lead to delays.
And doctors tell me that right now we really are at a critical time. If RSV cases continue to surge at the same time as flu and COVID, it could create what many people are calling a tridemic, in which case hospital capacity would need to expand. Right now, everybody's just taking a wait and see approach. As for baby Grant, well, there's some good news on that front. He and his family are likely going to be discharged very shortly here from Connecticut Children's. We're live in Hartford outside the hospital. Matt Caron, Fox 61 News.